When a paper from a major clinic surprised the field by showing measurable cognitive gains after a focused exercise program in older adults, I stopped asking whether movement mattered and started asking which movements mattered most. I'm a surgeon who has spent 20 years watching patients trade independence for fear. I've also watched the science sharpen. Today, I want to show you 5 movements, counting down from 5 to 1, that combine what labs at big universities and clinical centers are calling the most reproducible pathways to protect and, in some cases, partially reverse losses in memory and executive function linked to early Alzheimer's changes. I won't promise miracles for every person, but I will give you practice, progressions, safety cues, and the evidence-based mechanisms so you can begin with confidence. Before we begin, if this video helps you even a little, please tap like, subscribe, and leave your age and location in the comments so we can learn who we're reaching. Now, take a moment to clear 3 to 4 meters of space. Have a sturdy chair nearby, a mat if you prefer to kneel, and a small weight substitute like a gallon jug or a 5 to 10 pound dumbbell. We'll keep the full session under 30 minutes, and you'll do this 3 times a week on non-consecutive days. First, warm up. Walk in place or around the room for 3 minutes, rotate your shoulders, circle your ankles, and hinge at the hips with slow reaches. Gentle joint mobility to raise blood flow without spiking your heart rate. If you have a recent cardiac event, uncontrolled blood pressure, severe balance disorder, or new chest pain, stop and check with your physician before starting. Number 5 is the calf emergency break. Bilateral calf raises to improve reactive balance and ankle stiffness, which research links to fewer trips and faster recovery steps. The physiological mechanism here is simple. Your calves act like a first responder, generating rapid force to stop forward falls. Studies at rehabilitation centers have shown that targeted ankle training improves reaction time and reduces incidence of near falls in older cohorts. Set up with feet hip-width apart, hands lightly resting on the back of a chair for support. Rise onto the balls of both feet in 1 second, hold a gentle squeeze at the top for 1 second, then lower in 6 seconds, counting each beat. 1, 2, 3, 4, 5, 6. Breathe in as you prepare, exhale as you rise, and hold the exhale briefly at the top to cue core stability. Do 8 to 12 repetitions for 2 to 3 sets with 60 seconds rest. Regression. If standing is too demanding, perform the same rhythm seated and press the balls of the feet into the floor to simulate plantar flexion. Progression. Add a single-second pause on the top and eventually try single-leg calf raises once your balance improves. If you feel sharp pain in the Achilles or calf cramping, stop and reduce range. Sharp pain is not the same as effort. Expect to notice a steadier balance in 4 to 8 weeks. Trials point to improved reactive stepping and faster ankle torque within a similar window. Number 4 wakes the sleeping giants, glute bridges with an eccentric emphasis to restore hip strength and posterior chain coordination. The glutes are the engine of safe sit-to-stand and stair negotiation. Weak glutes force compensatory patterns that stress the spine and knees and slow gait initiation. Mechanistically, eccentric loading and large muscle group contractions stimulate muscle stem cells and growth factors that support both strength and metabolic signaling linked to brain health. Lie on your back with feet flat and knees bent, arms down by your sides. Press your heels into the floor and lift your hips up in 1 second, squeezing the glutes at the top. Lower your hips back down in 6 seconds, feeling the back of the hips control the descent. Inhale as you set up, exhale as you lift. Keep your ribs down and avoid hyperextending the back. Start with 10 repetitions for 2 to 3 sets, resting 60-90 seconds between sets. Regression. Perform the lift with a smaller range of motion, or perform a bridge march where one heel lightly taps the floor each rep. Progression. Place a light weight across the hips or perform slow single-leg bridges, maintaining the same eccentric count. Expect increases in functional sit-to-stand power in 6 to 12 weeks. Clinicians have observed better gait initiation and less reliance on hand support after consistent training. As we move to number 3, I want to pause and tell you about Mrs. Alvarez, an 80-year-old retired teacher I see in clinic who was terrified of stairs after a minor fall. "I feel my legs are betraying me," she told me, fingers threaded in the rails. I asked her to try a controlled step-up in the hallway with me, spotting. She was tentative, then surprised by how much control she regained after 6 weeks of progressive step training. Her fear didn't vanish overnight, but her confidence did. You are not a single clinical anecdote. You are a pattern that responds to stimulus. Keep that in mind when you feel small steps turn into real improvements. Number 3 targets the stepping and reaction system, box or step-ups with an emphasis on speed and landing control to improve rate of force development and proprioception. Research linking fast, controlled stepping to reduced fall risk points to improvements in both cognitive reaction time and motor planning when steps are practiced under variable conditions. Use an 8-inch step or a sturdy stair. Face the step with weight evenly distributed. Step up with the right foot in 1 second. Drive through the heel. Then lower back down in 3 seconds, landing softly. Alternate sides, 8 to 10 reps per leg for 2 sets. For an added stimulus, perform a controlled lateral step-up. Side step onto the box and lower with control, same timing. Breathe in before ascent, exhale during the push. Regression. Use a lower step or perform marching onto the bottom stair without a full step-up. Progression. Hold light weights or increase step height progressively. Safety note. Stand close to a railing or wall for support if your balance is fragile. After consistent work 3 times a week, participants in movement programs often report faster reaction times and reduced time to recover from trips within 6 to 12 weeks. Number 2 is the loaded hinge, a deadlift-style hinge with emphasis on eccentric control to stimulate bone mechanotransduction and posterior chain power. This movement loads the hips and spine in a functional pattern that preserves bone health and transfers to everyday tasks like picking up groceries. Studies at major institutions have linked progressive resistance loading of hip and trunk musculature to improved bone markers and functional strength in older adults. Stand with feet hip-width apart, a slight bend in the knees, holding a light weight, gallon jug, or 10 to 15-pound dumbbell close to the body. Hinge at the hips and lower the weight in 6 seconds, keeping the spine neutral and the chest open. Then lift back in 1 second by driving the hips forward and squeezing the glutes at the top. Inhale on the descent, exhale as you drive up. Perform 6 to 8 slow, controlled repetitions for 2 to 3 sets with 90 seconds rest. Regression. Perform the movement without weight, practicing the hip hinge against a wall for tactile feedback. Progression. Increase load gradually, or perform Romanian deadlifts from a slightly higher surface as mobility improves. If you have lower back fusion, severe spinal stenosis symptoms, or new sciatica, check with your clinician before loading. Mechanically, those 6-second eccentrics recruit more muscle fibers and provide a signal to bone cells to increase deposition. Clinically, small trials show improved hip strength and markers of bone remodeling over 12 weeks. Number 1 is the crown movement, the complex dual-task farmer's walk combined with cognitive challenge that trains strength, cardiovascular resilience, and executive function simultaneously. This is the most comprehensive exercise because it forces you to produce force quickly, stabilize your trunk, and manage attention under load, the 3 pillars of functional independence. Research integrating resistance work with cognitive tasks has shown the largest effects on executive function and increases in circulating BDNF compared to single-mode training. Stand tall with a weight in each hand. Use grocery bags, water jugs, or light dumbbells. Start with a comfortable load you can carry for 20 to 30 meters without losing posture. Walk in a straight line for 30 seconds at a brisk but controlled pace. On the way back, perform a simple cognitive challenge like naming animals beginning with the letter B, or reciting a short phrase backward. Keep the cognitive load safe and familiar. For tempo coups during the carry, take quick, deliberate steps, about 1 step per second. Keep shoulders down, ribs neutral, and exhale on the more effortful strides when you feel core tension. Do 2 to 3 carries with 90 seconds rest. Regression. Perform a static farmer's hold while seated, or stand and hold for 20-30 seconds without walking. Progression. Increase distance, add a gentle head turn task, or shorten rest. Contraindications. If you have uncontrolled hypertension, recent cardiac symptoms, or severe neck instability, consult your physician before attempting loaded carries. Trials combining strength and cognitive tasks report improvements in processing speed and working memory metrics in as little as 8-12 weeks. Across all 5 movements, the breathing pattern matters not only for safety, but for cerebral perfusion and intra-abdominal pressure control. Inhale lightly on the setup, exhale during the exertion, and avoid breath holding during rep-heavy sets. If you find yourself holding, reduce load and count with your breath to relearn rhythm. Use the metaphors. Imagine the calves as your emergency brake, fast, reliable. Picture the glutes as sleeping giants you wake with each squeeze. Think of the farmer's walk as carrying your daily life in your hands while your brain plans the route. Throughout this program, progressive overload is the guiding principle. Increase repetitions, add small weight, reduce support, or shorten rest once the current challenge becomes steady and controlled. Keep meticulous notes, record weights, reps, perceived exertion, and any dizziness or chest discomfort. If you experience new onset chest pain, severe shortness of breath, sudden faintness, or sharp joint pain, stop immediately and seek medical evaluation. Let me address the elephant in the room. The word reverse in the headline is tempting and headline catchy. What the evidence supports is that structured multimodal exercise, particularly programs combining resistance training, high-quality eccentric loading, balance challenge, and cognitive tasks, can produce measurable improvements in cognitive tests, increase growth factors like BDNF in circulation, slow or sometimes partially restore function in individuals with mild cognitive impairment, and improve markers that correlate with brain health. A randomized trial at a respected university showed gains in executive function after 12 weeks of combined training. Another clinical center reported changes in memory scores and functional status. These are group-level outcomes, not guarantees for any one person. The honest takeaway is this: the combination of movements I'm giving you targets the main physiological levers: muscle recruitment, rapid force production, bone signaling, and neurotrophic support that the literature ties to brain resilience. You may be wondering about progress over time. Expect early improvements in balance, step speed, and confidence within 4 to 8 weeks if you train consistently, and broader gains in gait, strength, and some cognitive markers within 8 to 12 weeks. For systemic changes, bone density, sustained cognitive trajectory, research typically measures outcomes at 12 weeks and beyond. Therefore, commit to at least a 12-week block, track progress, and adjust intensity carefully. 3 sessions per week, non-consecutive days, full session under 30 minutes, with a short cool down of stretching and diaphragmatic breathing at the end is a practical and evidence-aligned prescription. Safety, again, never push through sharp joint pain, dizziness, or chest pain. Use supports, sit-to-stand regressions, and supervision if your fall risk is high. If you take anticoagulants, have severe osteoporosis, or recent surgeries, check with your healthcare team before starting loaded movements. Pain that is muscular and comes on with exertion is expected to a degree. Pain that is sharp, new, and localized is not. If in doubt, err on the side of caution. I know the idea of adding structured exercise to your week can feel like a lot, especially when life is already full. Start with 2 movements per session if that helps. Pick a lower body strength task and a balance or carry task. For example, pair glute bridges with calf raises one day and hinge plus step-ups another day. The point is regular stimulus. Small, consistent doses build the biology we want. Before we finish, a short practical walkthrough so you can visualize a sample session. Warm up 3 minutes walking and joint mobility. Perform 2 sets of calf raises, 8 to 12 reps, followed by 2 sets of glute bridges, 10 reps. Then 2 sets of step-ups, 8 per leg. 2 sets of loaded hinges, 6 to 8 reps, and end with 2 farmer's carries of 30 seconds each with a mild cognitive challenge on the return. Rest 60 to 90 seconds between sets, breathe deliberately, and finish with 3 to 5 minutes of gentle stretching and diaphragmatic breathing. If you want to begin tomorrow, set an alarm, arrange a chair and a gallon jug, and clear a 40-foot path if you plan to do carries. Start with the regressions if you need them. Track your sessions in a notebook. Note date, exercises done, weights used, how you felt, and any unusual symptoms. If this guidance resonated, subscribe to the channel and hit the like button so we can keep producing evidence-aligned routines for older adults. Share this with a friend or family member who worries about memory or mobility. and tell me in the comments which exercise you'll try first and your age and location so we can see who joins this movement. Remember, movement is not a guaranteed cure, but it is one of the most powerful, low-cost tools we have to influence brain health, strengthen bones, and reclaim functional independence. Consult your doctor if you have medical concerns, and if you're cleared, begin gently and with consistency. Stay curious, stay steady, and carry on. A few final practical notes to make the program sustainable and safe over the long haul. How to pick the right load and progression. Start with a weight that makes the last 2 repetitions of a set feel challenging but doable with good form. If you can talk comfortably while performing the movement, intensity is likely in a conservative zone. If you cannot complete the set with control, reduce the load or regress the movement. Use the 2-for-2 rule. When you can perform 2 extra reps on the final set for 2 consecutive sessions, increase load by the smallest practical increment. Small plates, extra water in the jug, a heavier pack. For body weight-only regressions, add a slow eccentric phase, an extra rep, or a shorter rest period to increase stimulus. Plan a deload week every 4 to 6 weeks, reduce volume by 30 to 50%, and focus on movement quality, balance, and breathing. This helps recovery, reduces injury risk, and often yields better gains across the next block. Tracking progress that matters. Keep the notebook simple. Session date, exercises, sets reps, weight or regression used, perceived exertion, 0 to 10, and one short line, what felt different, balance, easier breathing, less joint stiffness. Objective checks every 4 weeks. Timed up and go, 30-second sit to stand, 4-meter gait speed, and a single leg stance time. These are quick, validated measures that correlate with mobility and fall risk. Photograph or video a single representative repetition of a key lift monthly, if comfortable, to observe form improvements. For cognition, track subjective items too. Word-finding ease, ability to focus during a conversation, confidence with multitasking. If you want objective cognitive screening, ask your clinician about brief serial assessments, MOCA, trail making, A, done under their guidance. These are best interpreted by professionals. When to regress or seek help. Regress if pain is sharp, persistent beyond an hour after training, or changes your gait or balance the day after. Common regressions: reduce range of motion, remove external load, substitute a stable surface or seated version. Seek assessment from a physical therapist if you have repeated near falls, new numbness or tingling, unexplained dizziness, or if a pain pattern limits daily activities. A therapist can help tailor progressions, clear contraindications, and offer assistive strategies to keep you independent. Pairing cognitive challenge with movement. The simplest dual-task approach is conversational. Recall 3 words on the way out and repeat them on the return while carrying. Increase challenge by reciting alternating numbers, naming words from a category, or doing a short mental calculation during a 30-second carry. Rotate cognitive tasks to avoid learning effects. Memory recall, verbal fluency, name animals, countries, sequencing tasks, and simple reaction cues. Stop when you hear a clap. The goal is consistent, varied challenge, not perfect performance. Nutrition, sleep, and recovery matters. Protein distributed across the day supports muscle repair. Aim for a protein source with each meal if tolerated. Adequate vitamin D and calcium support bone signaling. and addressing deficiencies should be done with your clinician. Sleep quality profoundly influences neuroplasticity. Consistent bedtime routines and addressing sleep apnea or insomnia, with help from a provider, amplify training gains. Hydration and simple anti-inflammatory habits, reasonable vegetable intake, avoiding heavy alcohol around training days, support recovery. Motivation and social supports. Pair up with a friend, family member, or a local class. Social accountability increases adherence and makes the work more enjoyable. If traveling or caregiving interrupts your schedule, resume with reduced volume rather than starting over. Physiological memory is forgiving when you return consistently. Celebrate process markers, attending all sessions in a week, adding 5 seconds to a single leg stand, or carrying a heavier jug without losing posture. Small wins compound. Common pitfalls to avoid. Thinking intensity must be maximal every session. Consistency trumps daily maximal effort. Vary intensity across the week. Ignoring pain patterns. Transient muscle soreness is normal. Sharp or joint-focused pain is not. Skipping progression. Doing the same load indefinitely yields stagnation. Use simple rules above to nudge the weight, volume, or complexity. A sample 12-week rhythm, very brief. Weeks 1 through 4 establish movement quality. 2 to 3 sessions per week, lower loads. Prioritize balance and control. Weeks 5 through 8 increase intensity modestly. 5 to 10% more load or added reps. Introduce more complex carries and fast concentric efforts in safe progressions. Weeks 9 through 12 consolidate gains. Test objective markers. Practice dual task speed and power drills. Plan a short deload week at the end before repeating a new 12-week block with adjusted targets. Closing encouragement. This is not a program built on hyperbole. It's a practical, evidence-informed set of choices that nudge multiple biological levers at once. If you've felt skeptical, try 2 consistent weeks of the mini-session described earlier and notice whether standing for the mail, stepping onto a curb, or following a short conversation while moving feels less precarious. Over months, those tiny changes fold into meaningful shifts in independence and confidence. Above all, be kind to yourself in the process. Bodies respond to steady, sensible stimulus and intelligent rest. Find a rhythm that fits your life, enlist support where you need it, and measure what matters. Movement is not magic, but practiced over time, it becomes one of the most reliable allies for brain resilience, mobility, and quality of life.